Hello, student nurse Jack here, and today we're going to be withdrawing medication from a vial. So, first step is here is my pretend MAR, and this is for Jane Doe, and this is the doctor's order. So, we have an order for 75 milligrams of AMIODRON intramuscular now. So, with that being said, I would do 75 milligrams, divide that by 150 milliliters, multiply it by 3, and then that'll get us to 1.5 milliliters of medication that needs to be withdrawn and administered. Okay, so I'm going to review the doctor's order. I'm going to check my 6 rights of medication, the right patient, medication dose, route, time. I'm going to review any other drug side effects, any expected results, positive expected results, any contraindications, anything like that that could happen from the drug, and just make sure that I'm knowledgeable of the drug and the correct dosage. After that, I will assess the patient's allergies and make sure that I check the patient for any allergies to the medication. I would have a second nurse verify the medication and that the medication is correct. We use my 2 patient identifiers, which is the name and the date of birth, and I would look at the barcode to make sure that I have the correct patient and that I'm administering the medication to the correct patient. So I would check the medication vial for the name, dosage strength, the dosage volume, and the route. I would absolutely check the expiration date. That is one of the most important things, is to check the date and to check for any discoloration or any cloudiness in the vial. So we would do our 3 checks for our medication label with our MAR. And then we're going to go ahead and perform hand hygiene, and we will glove up. So the first thing I'm going to do after putting my gloves on is remove the cap from the vial. Okay. I have my alcohol wipe here. I'm going to open the alcohol wipe. I'm just going to clean around the top of the vial. Okay. And then here I have my 5 milliliter syringe. Okay. So I'm going to withdraw and pull back to 1.5 milliliters of air. Okay. And then I have my needle here. I'm going to go ahead and cap my needle onto the syringe. Okay, so as you can see, I have 1.5 milliliters of air already in there and the cap. So what we're going to do is we are going to remove the cap of the syringe, and we're going to place it in this medicine cup here. Okay, I'm going to inject the needle into the vial right above the solution, not into the solution. You want to make sure that it is always at eye level. I'm going to use a plunger and inject the air. Okay. After that, I'm going to now go into the solution, and then I'm going to invert. And pull back the same amount. So the equal amount of air, we're going to pull it back the same amount of solution in the vial to 1.5 milliliters. There we go. I'm going to turn this back this way. Pull that out. And we are going to administer the medication to the patient, and we're going to verify, though, that we do have 1.5 milliliters of medication in here, and that the ordered amount was at eye level and that it is correctly drawn up in the correct amount and doses in the syringe. You're going to check for bubbles. If there are any air bubbles, you want to tap. Make sure we get the air bubbles out. And then after administering the medication intramuscularly, which it is now and immediately that it needs to be administered, we're going to recap our needle. Just like that. And then we're going to dispose of the syringe and the needle into our sharps container. Okay, and that is how you administer medication through a vial. Thank you.